Good evening, ladies and gentlemen. Welcome again to 103 FM's Men's Health Clip Hour. My name is Dennis Webster, and I'm your host this evening. And joining me again in the studio is the medical doctor and attorney, Dr. Flavio Cardone. Welcome, Dr. Cardone.
Well, hello, good evening.
You're
Dennis.
looking well.
Yeah.
I would like to start off by reminding you, our listeners, that you should always seek the advice of a physician or other qualified healthcare provider if you have questions regarding a medical condition, and that you never disregard professional medical advice or delay in seeking it because of something you have heard on this radio show. Dr. Cardone, it's the third leading cause of death in the United States, and after heart disease and cancer. What is it? It's medical malpractice. So when does this occur? Reports state it occurs when a healthcare provider deviates from the recognized standard of care in the treatment of a patient. Can you expand on that a little bit for us, Dr. Cardone?
Well, I would say that malpractice is not just a deviation from the standard of care, because the deviation from the standard of care can be justified. For instance, if a country does not have enough resources, or it was impossible to adhere to the best standard of care. I would say the malpractice is more something like negligence, or even, willful act by the doctor disregarding, common precautions. So malpractice is more than just a simple mistake.
Right. Can you give us a few examples of what would be regarded as malpractice?
Well, let's say it all depends on the context. But let's say a doctor giving a patient a medicine which causes him a severe allergy, when the notes clearly state that the patient is allergic to that medicine. That would be an example of malpractice. But of course, it's also important to note the difference between what people see on television and what happens in reality, because people see films and shows and think that any mistake committed by a doctor will result in lots of money and damages, and even if nothing really happens. So
Right.
suppose a doctor gives somebody medicine to which the patient is allergic, but then nothing happens. There's no allergic reaction. Yes, it was a mistake, but
no damages kind of occurred.
No, because nothing happened. So I would say that doctors have to be more patients have to be more realistic on what to expect in cases of malpractice.
You're listening to 103 FM, the first, the finest. If you'd like to be part of the show, you can call in. Our number here is 628-4103. You also have the choice to log in at 103fm.net, or if you like, you can send us a text message at 4103. Today we are discussing medical malpractice with Dr. Flavio Cardone, who has had extensive experience in both medicine and in law. He's here with us today. Dr. Cardone, let's talk about this thing called standard of care. What does that actually mean? Can you define that for me, please?
Well, the standard of care would be accepted medical practice. So more or less, especially in Europe, each country will have its national guidelines on how to deal with certain cases. And usually, if a doctor is not very experienced, he should stick to those national standards. Of course, if the doctor happens to be a professor who has studied the matter for 40 years, and he knows when he can deviate from the standards, then he can do that, of course, because if he knows when to deviate from the standards. But usually the moment the doctor deviates from the official standards of care, he's doing that on his own responsibility. If something goes wrong, then the doctor will be at fault.
Now, Dr. Cardone, do all physicians know, or should they all know, all these standards of care?
Well, I would say we're in Trinidad, so I would say yes and no, because in Europe, in the United States, and Canada, so in North America, each country will have its own standards of care, which will mandate certain actions, certain tests, and here in home you don't have this. So which one would apply here? The European one, the American one? There is no official recommendation. So I would say that the doctor here has to know, when the doctor decides to follow a certain course, he should at least be based on some of these European or North American guidelines.
Okay, so you're saying because we don't have any specific standards here in Trinidad, it's very difficult to say whether the doctor is negligent or whether he's actually met the standard?
No. No. What I mean is that the doctor here is not obliged by law to follow a certain standard like in some European countries, but still, if the patient feels the doctor has done something wrong, the patient can file a complaint and go to court against the doctor. But what I don't want to give the impression that here there is no such possibility. Here too, doctors have to abide by certain standards, and if the patient feels that the doctor has done something wrong, the patient can go to court and do something against the doctor. But what is important is to prove that the doctor acted in a negligent way, and that there have been damages. And that has to be proven, not just inferred, but with a good lawyers, many things that happen could result in damages. For instance, I see often here handwritten notes,
right?
And sometimes I find these handwritten notes illegible. And illegible notes could have an effect on the health of the patient. So
right. Now, have you had any personal experience where that has actually impacted?
Well, I haven't seen it happening, but statistically, I'm sure it must happen sometimes. And on the one side, patients should not expect too much from doctors. Doctors can make mistakes, and mistakes can be justified. But on the other hand, sometimes doctors try to hide these mistakes from the patients, and the patients should be compensated if something was done with negligence.
No, generally, when we go to doctors, we expect, they're going to basically tell us what to do, and then whatever their advice they're going to give us, we take as the given word that it must be correct. I mean, should patients be paying sort of close attention to a diagnosis, what that means, the disease process, maybe trying to learn a little bit more for themselves what's actually going on in their bodies?
Yes, the patient must too also, patient must understand what the doctor is telling him. The patient must also try to learn something about the medicine, but it's, if the patient doesn't understand, actually this can be considered fault on the part of the doctor, because the doctor should make sure the patient understands what is going on. For instance, I found it surprising that writing prescriptions, people write in shorthand, so they write POBD, meaning by mouth twice a day.
Yeah.
And it would be possible for a patient, in case something happens and they didn't take the medicine properly, to say, well, nobody explained to me
exactly
what it is, because they only wrote POBD.
Yeah.
So when I was here at first, I would write longhand, to be taken twice a day.
Right, to make it easier for them to follow.
Yes, but of course, this takes up more time.
Absolutely. You're listening to 103 FM, the first, the finest. If you want to be part of the show, please give us a call, 628-4103. Text us as 4103 or log on at 103fm.net. We'll be right back. Welcome back to 103 FM's Men's Health Tip Hour. I'm your host, Dennis Webster, and I'm visiting with my co-host, Dr. Flavio Cardone, who's now with me on this third show. Dr. Cardone, we have a call on the line, so let's just take this. He's gone? Okay, so we'll just continue. This is for a claim of malpractice, certain criteria have to be satisfied. Can you expand a little bit on those criteria for us?
Well, as we were saying, we have to prove that that the doctor made a mistake and was negligent. So I would say at first, if the patient thinks something has gone wrong, they should seek another doctor, because they have no confidence. Well, but we see we have a call now, so we'll take the call.
Yes, caller. You're on 103 FM's Men's Health Hour. Can I help you?
Hello, good evening.
Yes, hi.
Is that I would like, is that 103 program?
Yes, it is, sir. You're on 103 FM's Men's Health Hour. I'm Dennis Webster, and we are here with Dr. Flavio Cardone. Do you have a question for us?
You. Good evening, Dr. Cardone.
Yes, good evening.
And I have 3 questions for you.
Okay.
Yes. The first one, as a doctor practicing medicine, how can one reduce or lessen the risk of encountering a medical malpractice?
So, I understand you're a doctor, and so
Yes.
I would say the best thing to avoid getting into a lawsuit with a patient is, if you made a mistake, go and tell the patient and say you're sorry, and be very humble about it, because that is what causes most of the lawsuits, is the patient being angry with the doctor. And if you say you're sorry, if you admit you made a mistake, it doesn't mean you're admitting that you committed negligence, because your mistake can be justified. So many doctors are afraid of just telling the patient, I'm so sorry this happened, and things like that. And this is what causes the lawsuit.
Okay, so maybe I can tell you the next and third question, then I'll cut the line, then you can answer me.
Okay.
Yeah, then the second one is, how do you distinguish a bad medical outcome from a medical malpractice? And the last question is maybe for your colleague. Do we have any statistics of how many people die in Trinidad as a result of medical errors? Thank you.
For the third question, I don't have any of those statistics right now. I'm trying to see if I can gather some statistics on how many deaths we're having from malpractice. So as soon as I have that, I will let you know. It'll be on this show.
I would say also, answering the third.
Dr. Cardone is going to try and.
Yes, I would say probably the statistics here will show that almost nobody dies because of medical malpractice, because I'm sure the cause of death will be registered as as heart attack or something, but nobody will ever write iatrogenic, which in English means caused by the doctor. So I'm sure you will find that almost nobody dies here with clear iatrogenic causes. And you had asked between the difference between a bad outcome and malpractice.
Yeah.
So the bad outcome, you did everything you could to avoid that bad outcome, but statistically a certain percentage of people with that same disease will end up badly, and you can't avoid it. If you did what you could, then it's not malpractice. Malpractice would be if you didn't do everything, if you just relied on statistics and thought, well, most people, they live through this, so I'll just give them, a pill and send them home instead of doing everything I should do.
I heard one comment was most young people get this. And it turned out that the poor young lady had serious thyroid cancer. So yeah, making nonchalant statements like that could get you into a lot of hot water.
Well, let's say that making the statement no, just making the statement would be rude, would be something like that. But if the statement must have had some consequences. So
I mean, a statement like that followed by no further investigation.
Yes,
of the
yes.
problem,
If somebody has something that looks like cancer,
you have a growth in your neck, you can't move your neck. But something like young people get that, and no further investigations done. Turns out there's a serious cancer that the person's facing. I mean, that's pretty traumatic.
yes. Well, that would be malpractice.
Right.
That would be a very good example
Absolutely.
of malpractice, and somebody like that in that case could go to court and get compensation for this.
Right.
I would say that the first step, if you suspect you have been having you're a patient who suffering from malpractice, and go to another doctor, and also find a lawyer who is specialized in malpractice cases. Unfortunately, I think here, Trinidad is a small country, so it's very difficult to be able to do that, because people know each other, and it's difficult for a doctor to go against somebody who is his friend.
Absolutely.
So, but I would say the first step is try to get advice from another doctor, from somebody who is not linked to
the situation.
Yes, yeah. And I would like to say I'm not advertising myself here, because I don't do this here in Trinidad. And
you're listening to 103 FM. I'm Dennis Webster. I'm here visiting with Dr. Flavio Cardone, a medical doctor and lawyer. If you want to be part of the program, you have options. You can call us at 628-4103, or you can log on online at 103fm.net, or you can send us a text, please, at 4103. So, Dr. Cardone, tell us some more points that basically have to be covered before you can really have be in a situation where you can actually claim malpractice. What are the criteria have to be set?
Well, you have the most important thing, I would say, first, try to get copies of all your records, because the hospital will try to make it harder for you, because they lose money if you win at court. So you have to get copies of everything, and you have to insist on that, because hospitals won't
give it voluntarily.
Yes, they won't make it easy for you.
And on that note, I'd like to interject that I encourage people to keep copies of all their reports anyway in a file, because they have to tell a story. This happened, and we did this, and the outcome was this.
Yes, especially as here very often records are not kept on a computer, so they could be lost.
Right.
Really, they could be, they could just vanish.
Right.
So I would say yes, keep keep a copy of everything.
Blood tests, ultrasounds, whatever you have done, make sure you have a copy for your own records.
Yes, yeah. And and even if you think it won't, yes, the doctor made a mistake and I'll go to court and nothing will happen. It's not true. You should try to...
So work with the process.
Yes, try to, fight for your rights, fight for your case. Because otherwise also, otherwise nothing will change.
Absolutely.
Everything will stay the same, and what that doctor did to you, they will be able to do it
to someone else.
Yes, a lot more. And and as they say, you hit one, you teach 1,000. So
right.
If you're a patient and you're fighting for your rights, you can make a nice big change. Because remember, the judges are also patients, and the further the case goes up to court, the older the judge will be.
Right.
And older people tend to need more doctors. So an older judge, who thinks that, maybe this will happen to me because I'm starting to get the age where heart fails and things are not so well, the judge will hit hard the doctor who has made a mistake. So, don't let things just stay as they are, and eventually, you can win. You can win in court, and hospital, especially if it's a doctor who's working at a hospital, hospitals have insurance which covers them. So don't think the hospital doesn't have any money, or
because if you're injured, it impacts heavily on you, especially if there's a sole breadwinner for your family. So so you were thinking like standards are a good thing to put in place right now to help sort of reduce that possibility?
Yes, official standards help both the doctor and the patient.
Absolutely.
Because the doctor will have to comply with those standards.
Right.
In a way, too, standards can be harmful if the doctor starts to become afraid to deviate from the standards. Because sometimes standards are too rigid, and there should be a little leeway so the doctor can apply them can mold them to a certain situation.
Yes. You're listening to 103 FM. I'm here with Dr. Flavio Cardone. I'm Dennis Webster. If you want to be part of this, give us a call, 628-4103, or you can log on at 103fm.net. And your third option is to text us at 4103. We'll be right back. Good evening, ladies and gentlemen. Thank you for joining us on 103 FM's Men's Health Tip Hour. My name is Dennis Webster. I'm your host this evening, and joining me again is Dr. Flavio Cardone. I'm just going to take a short break here because we have a call on the line. Let's take this call. Yes, caller, you're on 103 FM's Men's Health Tip Hour. Can we help you?
Hi, good night.
Good night.
You guys doing a great job.
Thank you very much.
My question is a two-part question. With respect to visiting a doctor, normally here in Trinidad, we are often told it's a good idea to bring along a spouse, a relative, or a friend.
Absolutely.
And visiting the doctor.
Yes.
While I agree that this is a good gesture, simply because sometimes something the doctor might have said may slip your attention.
Right.
The accompanying person will pick up on it.
Yes.
My question is,
can you come closer to your phone?
Shouldn't a patient have a right to, say, have a recorded discussion or conversation simply because this patient would have information as to validate a confirmation of what was said? So to have a closer...
So you say you want to have permission basically to take a recording device and
yes, regarding
tape
their
the
health.
session.
My second part question is, if one is suing for a loss of a loved one as a consequence of negligence through malpractice, why is it the law here bases that person whose life is lost through the person's age? Say, for instance,
Come closer to your phone, dear.
The basis is used around principle, according to what the person worked for a month. Is this a fair practice? Thank you. I'll be listening to your answers. Good night.
Thank you for calling.
Okay, so first, you mentioned bringing a relative or a spouse or a friend together with to go to the doctor. Yes, you can do that, but sometimes you have to remember the patient may not want to say some things in front of the spouse, relative, or friend. So, I don't know if it's a very good idea to do it every time. If it's somebody who is, let's say, old and maybe will not understand what you're saying, it's an excellent idea, because sometimes I see people that are quite old and I am sure they're not understanding very well what they should be doing, and they go with their children, and children are 60, but and who understand exactly what is going on. So that's much better. You asked if the patient has the right to record the visit. I would say no. The patient doesn't have the right to do that. The patient can ask the doctor if the doctor allows.
Okay, so both parties need to be agreed.
Yes, because you can't record someone without their permission. So if the doctor says, no, I don't allow you to record the conversation, then you're not allowed to do that. But if the doctor agrees, why not? I myself wouldn't agree, but I'm a lawyer, so I always, worst case thing. Then I don't know if I heard quite well, because you moved a bit away from the phone, but you were asking why is compensation
based on
based on the age. Well, that's very simple, because the compensation is for the money the person will not have earned. So the compensation is not for the loss of life, because life doesn't have any price. You cannot put a price on life, but on the loss of earnings. So if it's somebody who was going to live 5 years more, and then they would.
How do you make that calculation, though, Dr. Cardone? I mean, people are living longer today based on new technology.
Well, statistics. Just statistically. So let's say somebody who is 18 probably will live a lot longer than somebody who is 80. But of course, there is no sure way of determining that.
Right.
So, but this is the only way we can more or less.
So someone who's 55, I mean, how long are they expected?
Well, depends on their condition, so that would have to be taken into consideration. Maybe, and depends on the job they have, because if it's a job that they would be able to work until they're 90, it would be different than if they have a job, let's say, breaking stones, which they won't be able to do after a certain age.
Right.
And also, it doesn't seem fair, but that's how it is. So imagine if you have, let's say, if you have an accident with your car, if you hit a normal car, you pay just for the, for the repairs. If you hit a taxi, you pay for the repairs plus
wages have been lost.
Yes, that's more or less how it works. So, somebody who's very old, if the doctor by mistake shortens their life by 1 year, it's a lot. Somebody who had a very advanced cancer and was going to die in 1 year, and they die in 6 months. That's different from causing the death of a 14-year-old healthy boy who was going to live all his life. So.
What about someone who passes on because of a wrong diagnosis, a wrong treatment?
No, but again, it depends on the amount, if we're talking about the amount of money they will get as compensation, it depends too on all these things. Because unfortunately, it's not. That's how the law works, with the wallet, not with the heart. So.
Yeah. On the second point about bringing someone with you to your doctor's visit, I think it's a good idea, especially if you're going to be receiving news that's serious news, because that can be a very stressful, time for someone to sort of absorb all the information that's being said. So having an extra pair of ears sometimes is a good thing, because you can bounce off information later on to make sure that what you heard was actually correct.
Yes, that is also true, because especially when people come to hear very bad news, they stop paying attention.
Absolutely.
Right away.
Especially use that C word, like
yes,
shuts down at that point.
Yes, but cancer, people shouldn't be so much afraid of cancer, because some cancers are so slow that you'll end up dying of something else before the cancer.
Hint, like prostate.
Yes.
So a prostate cancer diagnosis is not, end of life situation. So don't be afraid.
I mean, we're all going to die anyway. So, and prostate cancer probably means you're going to die of something else.
Yes, exactly.
So,
so moving right along here, Dr. Flavio, what are the other criteria that have to be met before someone can bring a case of malpractice? Because from the research I've done, it appears that it's a very difficult thing to be successful.
The most difficult thing, I think, is to prove the malpractice,
right.
Because you have to prove that the doctor actually did something wrong, and you have to prove that the mistake was it was not a common mistake that everyone would make. It was really a bad, negligent mistake. So let's say if I ask you, do you have any allergies?
Mm-hmm.
And you say, no, I don't. I give you some medicine and you get an allergy. Mm-hmm. And then I didn't do anything wrong, because you told me you didn't have any allergies. Mm-hmm. But if I don't ask you, mm-hmm. and I give you some medicine and you get allergy, then I can be at fault because I didn't ask you. However, I'm not required to test you for allergies. I just ask you. You say no, and that's enough, because I can't test you for everything. And this is why it is important to know one's allergies. Also, one thing important is that here in Trinidad, people like to say they're allergic to something. And now, an allergy means you get all red and itchy,
a little rash,
and you get very sick. Doesn't mean you don't like the taste of the medicine. Doesn't mean that you think the pill is big, and because the moment you tell me I can't take this because I have allergy, then I'm not giving it to you. Even if you tell me after, you tell me no, but what I mean is that it's bitter, and no, you told me you have allergy, I'm not giving it to you. Go to someone else. Because I'm not going to risk getting in trouble because you don't know what is an allergy. Because I have people who have diabetes and come to me and say they are allergic to insulin. Now, you can't be allergic to insulin because insulin is produced by your own body. Yes. So you can't be allergic. It's not possible. Yes, it's not possible. Right. So, but okay, you're allergic to insulin. Fine, you're not getting it.
What about the time comes when they need insulin?
Well, but they won't get it from me. They'll get it from someone else. Okay, yeah. I'll do what you told me. You told me you're allergic, so you're not getting it.
Okay, well, we have a text message coming here. The individual wants to know, can one change from using insulin to medication if their diabetes is under control?
So you want to change insulin to
metformin or something.
yes, in certain cases it's possible.
Okay.
But
Can you give me an idea of some?
No, because it has to be very individual.
Okay.
It would depend on the whole history of the patient. It's
the answer
not
is
so
yes,
easy.
but it depends on the situation.
Yes, but I'm not going to say no, it's impossible.
Right.
I say it is possible, but it depends.
Right.
It can happen if they're not taking too much insulin, then it would be possible to.
Right.
But usually when you're getting insulin, it's when
It's because they've exhausted everything
yes,
else, right?
but it can
That's
be.
not 100%.
No.
Right. There's always an exception to the rules.
No, actually, it's more common than just an exception. I would say that if it's early, people can still more or less go back to taking oral medication, but they have to follow a diet and exercise and lose weight and keep to a diet especially.
So it really depends on how severe your diabetes and
how much you're controlling it. Because
yeah. So that's the issue, is controlling it. So it's important that as I say, you watch that hemoglobin A1C.
I mean, don't give up hope. Go to your doctor, because depending on how much insulin you're taking, maybe it's possible.
You're listening to 103 FM. You can join the show if you like by calling us at 628-4103. You also have the option to log in at 103fm.net, or you can send us a text, please, at 4103. We'll be right back. Good evening, ladies and gentlemen. Welcome back to 103 FM's Men's Health Power. I'm Dennis Webster, and I'm your host this evening. Joining me is, as always, Dr. Flavio Cardone. Dr. Cardone, I'd like to talk a bit about how important is it that people know their rights?
Well, it's very important, but I would say that more than just knowing their rights, they should not be afraid of exercising their rights, because
Absolutely.
if they know their rights but they don't exercise them, then they don't
What's the
have
sense of
them.
having rights? Yes.
Yes, so patients have the right to have copies of their records, of having a proper visit.
Actually, on that point, the copy of the records, it actually says in there you're allowed to actually review your information, but they don't allow you to get a copy of it, which I think is, which I think sort of, I think that's kind of supports, a lack of transparency.
Well, you review it and then you take a picture with your phone. So you mean?
But they said no, you can't have copies of your report. I thought, no, that doesn't sound right to me.
No, I think if they don't want to give you a copy of your records, it's very easy to get a judge to
get them to release that to you.
Yes.
Because you should have it. I mean, they are it's about your health.
Yes.
And,
So you can. That's very easy to overturn. I mean, I think they probably say no, we won't give you a copy. To make it harder for you.
Right.
And so you would have to go to a lawyer, pay the lawyer to write a letter saying, give us a copy or else.
Right.
So, but I would say if they don't let you get a copy, okay, I'm reviewing the records with my phone and I'll take a picture of it.
We have a call on the line. Yes, you're welcome. You're at 103 FM's Men's Health Power. Can we help you?
Hi, good night.
Good night.
I would like to ask a question.
Absolutely.
How do we know when our doctor's credentials are expired, and how often should they be brought up to standards? Thank you.
Okay, that's in Trinidad. That's actually easy to check. You can go to the website of the medical board, and I don't remember exactly where on the website, but I think they have a list of all the doctors that are licensed in Trinidad, so you can just check there. If the doctor's name is on the list, then his license here. That's very easy to find out.
Okay, caller, thank you. Right.
So we are going back to the patient rights. Yes, I mean, they don't let you copy the records, bring your phone, take a picture of them. So, and they can't prevent you from
doing that.
From doing that, yes. So, you know, it's like cat and mouse. They try to make it harder, and you have to be more clever than they are.
So you have to be more persistent, and
Yes, but also what the caller was saying, checking if the doctor is actually a doctor. This is also important because sometimes you see people claiming to be specialists when they are not. So some people say they are
urologists.
Yes, they say they are heart doctors, cardiologists. And then when you actually see the name and surname, they like to add letters after the surname. So you see, I don't know, John Smith, MRCP, MBBS, lots of letters after the name. Yes, and you think, well, this must be a good doctor because he has all these letters. But you don't know what these letters are. So some people say, well, that's a heart doctor, but I see the credentials mean that he passed the British licensing exam to be a doctor, but he didn't actually. He's not a cardiologist. No. So when you see all these letters after a doctor's name, be curious.
Ask questions.
And
where did you do your training?
Yes, but the doctor, can say things. Check on the internet what those letters mean. And if he's saying, he's a heart doctor, a cardiologist, so ask. So are you a consultant in cardiology? And if he says no, but I means you're not. So it's like being pregnant. Either you are or you're not.
There's no in between. There's no gray area here.
Yes.
Right.
So so check if the doctor. This unfortunately here you have to pay attention if the doctor says he's a pediatrician. Check if why they're saying that.
Check the credentials. Make sure they are what they say. What about the value of getting a second opinion? Is that one way that people can actually go one route they can go to actually?
Well, that's a good way to know if you're getting a good doctor, because the good doctor won't mind you getting a second opinion, and will actually be glad that you're getting a second opinion. So you have less responsibility.
We have another call on the line. Yes, caller, you're welcome. This is 103 FM's Men's Health Clip Hour. How can we help you?
Hello, good night.
Good night, sir.
What I want to find out is that when you go to a hospital or one of the private nursing homes, right, they charge you all this money for treatment, and then they tell you have to go to a specialist. I had a problem about a year ago. I went in the nursing home. I won't call the name, and I told the guy I was having pains. I'm a heart patient. I had a heart attack a few years ago. Not really a heart patient, but I had a heart attack. And I told him it seems that I'm having another heart attack. Right? And they checked me over and all the things that I had. It was really food poisoning. Right? And they took 3 days to determine that it was food poisoning. Right? And they were taking blood tests and all kind of things. So this is what I was finding out. Why it is that they do these things to people, right? And they keep charging you and adding up on the bill, and the money keeps raising.
Right.
For no reason at all.
So you're feeling that they were doing a lot of things that they shouldn't be doing?
But you have
your. Because it can't take 3 days to determine hard food poison, could it?
Right.
No, but you have your answer right there. As you said, they charge a lot of money. So why they do this? Because they want to buy things with your money. That's why they do that. So unfortunately, you had, you should. They shouldn't have. I know it's wrong.
It seems to be a trend.
Yeah.
It seems to be a trend now in Trinidad. Where doctors just keep charging you and making the bill just keep rolling up. What they could treat you for simple things.
So it feels sometimes like it's a medical mafia almost.
I went back to the same nursing home a little while after.
Yes, but you have to.
I had a kidney stone problem, right? The scan and ultrasound and so on. So yes, you have a kidney stone. So what could you do about it?
Yes, but listen, you're from Trinidad. You're the one who can vote. I'm not from Trinidad. I can't vote here. So you're the one. You have to complain. You have to.
This is what I'm saying. I asked the guy. I said, "What you could do for me now?" All he could do is give me some painkillers and give me 2 injections, easy pain, and I have to go see a urologist. When they call the urologist now, he have to take 3 weeks before he can get an appointment. So in that time now,
you're suffering.
He charged for one set of money just to see me.
And you're still suffering.
I was in the hospital. I want some money for that. And then it's the same thing all over again. It's only about the money. It's not about taking care of the patients. These nursing homes ripping off people.
I know, but I agree with you. It's a scandal that they work this way.
The doctors for doing it. Because if you're a doctor, I mean to say you have to have some sort of a conscience.
Yeah.
You must know what's but this is wrong to a man. Tell him to get treatment or treat him. Why are you leaving a man in pain and only concerned about the money?
Yeah, because because look, I'm a doctor too, but unfortunately that's how they behave. They start seeing it more as a business. And they charge
this is
you.
Come into in this country. The doctors in this country just seem to be making it more of a business than a service. Right? You're a doctor, and you're sick. You go to the doctor. Instead of he's looking to cure you, he's looking to see what money can siphon out of you.
Yes.
When I had my heart attack a few years ago, I was in another nursing home, and they didn't want to. They couldn't do anything for me, and they didn't want to release me.
It's horrible.
And the bill just keep running up to be $60-something thousand, right? And they just don't want to release you. I had to walk myself out of the hospital.
But look, they didn't want to release you. You can always leave a hospital when you want.
Well, I have to leave. I leave on my own because they didn't want to release me.
Yes, you always have the right to leave whenever you want.
But this is the problem. If you know you can't do anything for me again,
tell you up front.
Tell the patient, listen. You have to seek medical help somewhere else because we are in no position to help you no more. Stop draining the money. And these are the doctors who have these prestigious positions, and these are the men who have a big name, and they keep doing this to people.
So it's a bad thing that keeps perpetuating itself.
But that's why not only you, other people who are listening now, you have to do something. You have to complain.
You can't go to the medical hospital, the public hospitals to get treatment because there's a problem there. When you go to the private institutions to get treatment, there's a next problem they're ripping you off.
But a lot of times, when you finish with the private, you end up in public eventually, right?
This is what I'm telling you. You go to the public hospital, there's a problem there to get treatment.
It's a vicious
cycle.
cycle.
You go to the private hospital, there's a problem there too.
Yes, sir.
So what are people supposed to do now?
What you're supposed to do, you vote in Trinidad and strike and make something to change, to make the government notice you. But now we are finishing our program, so we won't be able to organize that. But next week you can call again, and then we can talk some more about.
Okay then.
Okay, Dr. Cardone.
Okay, good night.
You can talk to him again. Okay, ladies and gentlemen. We are coming to the end of the show tonight. I would like to close the program by saying don't be afraid to get a second opinion, and don't be afraid to find a new doctor if you don't feel that you're receiving proper medical care. This is your health. Your health is too important to place in the hands of a provider who hasn't earned your confidence, isn't answering your questions or concerns, and not giving your condition adequate time and attention. You're listening to FM 103 FM, the first, the finest. A pleasant good night to you all.